Every morning, millions of seniors wake up, pour a glass of water, and take their medications before eating breakfast. It seems like the right thing to do. After all, taking medicine on time is an important part of staying healthy. But here's something many people don't know. Some medications should never be taken on an empty stomach. Doing so can increase the risk of stomach irritation, nausea, dizziness, dangerously low blood sugar, or even make the medicine less effective. What makes this even more concerning is that many older adults have been following the same routine for years without realizing it could be causing problems. They assume the symptoms are simply part of getting older when, in some cases, the timing of their medication may be playing a role. Take James, for example. At 74 years old, he never forgot to take his morning pills. Every day, before breakfast, he swallowed all of them with a glass of water. Over time, he began feeling weak, lightheaded, and sick to his stomach. Some mornings, he even felt like he might faint. He blamed old age and never imagined his medication routine could be the cause. During a routine doctor's appointment, James mentioned how he had been feeling. After reviewing his medications, the doctor quickly noticed that one of them should always be taken with food. James made that one simple change, and within a few weeks, his nausea and dizziness became much less frequent. He hadn't changed the medicine only when he took it. Stories like this happen more often than you might think. As we age, our stomach becomes more sensitive, and our bodies process medications differently. That's why taking medicine exactly as directed becomes even more important after the age of 70. In today's video, we'll discuss 9 medications that seniors should never take on an empty stomach, explain why food matters, and share simple tips to help you avoid common medication mistakes. Remember, never stop or change a prescribed medication without first speaking with your doctor or pharmacist. Before we begin, please like this video, subscribe to Ageless Wellness TV, and share it with someone you love. The information you're about to hear could help prevent a serious health problem. Now, let's begin with the first medication. Medication number 1. Pain relievers such as ibuprofen and naproxen. Many seniors take pain relievers every day to manage arthritis, back pain, joint stiffness, or muscle aches. Medicines such as ibuprofen and naproxen can be very effective, but they can also be tough on your stomach if taken without food. These medications belong to a group called nonsteroidal anti-inflammatory drugs, or NSAIDs. They reduce pain and inflammation, but they also reduce some of the stomach's natural protection. When taken on an empty stomach, they can irritate the stomach lining, causing heartburn, nausea, stomach pain, or indigestion. Over time, regular use may even increase the risk of stomach ulcers or internal bleeding, especially in older adults. Taking these medicines with a meal or even a light snack can help protect your stomach. It's also important to use the lowest effective dose for the shortest time recommended by your healthcare provider. If you notice severe stomach pain, black or tarry stools, or vomit that looks like coffee grounds, seek medical attention immediately. These could be signs of serious stomach bleeding. Medication number 2. Diabetes medications that can cause low blood sugar. Many seniors living with diabetes take medications that help lower blood sugar. Some of these medicines are designed to work when you eat. If you take them on an empty stomach and delay or skip your meal, your blood sugar may drop to low. Low blood sugar can develop quickly. You may feel shaky, sweaty, weak, dizzy, extremely hungry, confused, or notice your heart beating faster than usual. If left untreated, it can become a medical emergency. To help prevent this, try to eat your meals on time and take your medication exactly as your doctor has instructed. If you're feeling unwell and can't eat, contact your healthcare provider for advice instead of skipping meals or changing your medication on your own. Always remember that diabetes medications work best as part of a healthy routine that includes regular meals, physical activity, and monitoring your blood sugar when recommended. Next, we'll discuss 2 more medications that many seniors take every day and why taking them with food may help prevent uncomfortable and sometimes serious side effects. Medication number 3. Steroid medications such as prednisone. Steroid medications like prednisone are often prescribed to treat arthritis, asthma, allergic reactions, and other inflammatory conditions. They can be very effective, but taking them on an empty stomach may increase the risk of stomach irritation. Some seniors experience nausea, heartburn, stomach pain, or indigestion when they take steroids without food. If these medications are used for a long time, especially together with pain relievers like ibuprofen or naproxen, the risk of stomach ulcers or bleeding may also increase. Taking your steroid medication with a meal or a light snack can often help reduce these side effects. It's also important to take steroids exactly as prescribed. Never stop them suddenly unless your doctor tells you to, because doing so can cause serious health problems. Medication number 4. Metformin is one of the most commonly prescribed medications for type 2 diabetes. It helps control blood sugar, but it can also upset the stomach, especially when you first start taking it or when your dose is increased. If metformin is taken on an empty stomach, it may cause nausea, diarrhea, bloating, stomach cramps, or discomfort. Taking it with food can make these side effects much milder and help you continue your treatment more comfortably. Some people stop taking metformin because of stomach problems without telling their doctor. This can cause blood sugar levels to rise and increase the risk of serious complications over time. If you continue to have stomach upset even after taking metformin with meals, don't stop taking it on your own. Speak with your healthcare provider. They may adjust your dose or recommend an extended release version that is easier on the stomach. Medication number 5. Iron supplements. Iron supplements are often prescribed for seniors with iron deficiency anemia, a condition that can cause fatigue, weakness, shortness of breath, and difficulty concentrating. Iron is essential because it helps your body produce healthy red blood cells that carry oxygen throughout the body. Although iron is absorbed best on an empty stomach, many seniors find that taking it this way causes nausea, stomach pain, heartburn, cramps, or even vomiting. If these side effects make it difficult to continue your treatment, your healthcare provider may recommend taking it with a small meal or snack. While this may slightly reduce absorption, it often makes the supplement much easier to tolerate. It's also helpful to know that coffee, tea, dairy products, and calcium supplements can reduce how much iron your body absorbs. Unless your doctor tells you otherwise, try not to take them at the same time as your iron supplement. Iron tablets can also make your stools appear dark or black, which is usually harmless. However, if you have severe stomach pain, black sticky stools, or vomit that looks like coffee grounds, seek medical attention immediately, as these could be signs of internal bleeding. Finally, never start taking iron supplements just because you feel tired. Fatigue has many possible causes, and too much iron can be harmful. A simple blood test can determine whether your body actually needs extra iron. If iron supplements continue to upset your stomach, don't stop taking them without speaking to your doctor. A different form of iron or a lower dose may work better for you. In the next session, we'll cover 2 more common medications that many seniors take and explain why taking them with food can help prevent unwanted side effects. Medication number 6. Aspirin. Many seniors take low-dose aspirin every day to help reduce the risk of heart attack or stroke. Others use regular-strength aspirin for pain relief. While aspirin can be very helpful, taking it on an empty stomach may irritate the stomach lining and increase the risk of bleeding. Some people experience heartburn, nausea, or stomach pain shortly after taking aspirin without food. With long-term use, the risk of stomach ulcers and internal bleeding becomes even greater, especially for seniors or those who also take blood thinners or other pain relievers. Taking aspirin with a meal or a light snack may help reduce stomach irritation. However, never stop taking prescribed aspirin without talking to your doctor. For some people, stopping suddenly may increase the risk of a heart attack or stroke. If you notice black, tarry stools, vomit that looks like coffee grounds, or severe stomach pain, seek medical attention immediately. Medication number 7. Certain antibiotics are used to treat bacterial infections, including chest infections, urinary tract infections, and skin infections. Some antibiotics can cause nausea or stomach discomfort when taken without food, while others are specifically meant to be taken on an empty stomach. That's why it's so important to read the instructions carefully. If your prescription says to take the antibiotic with food, don't ignore that advice. Eating first can help reduce nausea, stomach cramps, and diarrhea, making it easier to complete the full course of treatment. Also remember that some antibiotics should not be taken at the same time as milk, calcium supplements, iron tablets, or antacids, because they can reduce how well the medicine works. If you're unsure, ask your pharmacist for guidance. Even if you start feeling better after a few days, always finish the entire course of antibiotics. Medication number 8. Potassium supplements. Potassium supplements are often prescribed for seniors who have low potassium levels, especially those taking certain diuretics, also known as water pills. Potassium is essential for healthy muscles, nerves, and a normal heartbeat. However, taking potassium supplements on an empty stomach may cause nausea, stomach pain, vomiting, or irritation of the stomach lining. Taking the supplement with a meal and a full glass of water can often help reduce these side effects. It's very important to take potassium exactly as prescribed. Too little potassium can lead to muscle weakness, cramps, or an irregular heartbeat, while too much potassium can also be dangerous, particularly for people with kidney disease. Never change your dose without first speaking with your healthcare provider. Medication number 9. Osteoporosis medications. Our final medication comes with an important exception. Medicines used to treat osteoporosis, such as alendronate, are usually meant to be taken on an empty stomach, not with food. These medications should be taken first thing in the morning with a full glass of plain water. After taking the tablet, you should remain sitting or standing, and avoid eating, drinking anything except water, or lying down for at least 30 minutes. Or for as long as your doctor or the medication instructions recommend. This helps the medicine work properly and reduces the risk of irritation to the esophagus. This medication reminds us that there isn't one rule that fits every prescription. While many medicines are safer with food, others are specifically designed to work best on an empty stomach. If you're ever unsure about how to take a medication, don't guess. Read the label carefully and ask your doctor or pharmacist for advice. A simple question today could help you avoid unnecessary side effects. Tomorrow, in our final session, we'll review the key lessons from today's video and share a few simple habits that can help you take your medications more safely every day. We've covered 9 common medications that seniors should pay close attention to when it comes to taking them with or without food. These included pain relievers like Ibuprofen and Naproxen, diabetes medications, Prednisone, Metformin, iron supplements, Aspirin, certain antibiotics, potassium supplements, and osteoporosis medications. The most important lesson is simple. Never assume all medications should be taken the same way. While many medicines are safer when taken with food, others are designed to work best on an empty stomach. Always read the label and follow the instructions from your doctor or pharmacist. Here are a few medication safety tips to remember every day. First, keep an up-to-date list of all the medications, vitamins, and supplements you take. Bring that list to every doctor's appointment so your healthcare team can check for possible interactions. Second, take your medications at the same time each day whenever possible. A pill organizer or a phone reminder can help you avoid missed or double doses. Third, if a medication causes nausea, stomach pain, dizziness, or any unusual side effect, don't ignore it. Don't stop taking the medicine on your own either. Contact your healthcare provider. Sometimes a simple change in timing or dosage is all that's needed. Finally, remember that medication is only one part of staying healthy. Eating balanced meals, drinking enough water, staying active, and attending regular checkups all help your medications work more effectively. If you found this video helpful, please give it a thumbs up, subscribe to Ageless Wellness TV, and turn on the notification bell so you won't miss our future health tips for seniors. Share this video with a friend, family member, or caregiver. It could help someone avoid a serious medication mistake. Thank you for watching, and thank you for being part of the Ageless Wellness TV family. Until next time, stay healthy, stay informed, and always take your medications exactly as directed by your healthcare provider.